Good afternoon, everyone. Welcome to the 2025 12th Summit, Vapid and Destined to the Goal. My name is Kenyatta Royal, and I am honored to serve as your Mistress of Ceremony for day one of this powerful two-day summit.
Now to officially open the summit with a call to action rooted in data, urgency, and the possibility of transformation, please welcome Ms. Alma C. Stewart Allen. Ms. Alma is a registered nurse, a former career state civil servant, an entrepreneur, and an avid public health advocate. A tireless advocate for systematic change, she leads the statewide initiative LA40BY30, which aims to elevate Louisiana's health ranking to 40th or better by the year 2030. Alma is known for building coalitions, shaping policy, and amplifying the voices of those most affected by health disparities. Please join me in welcoming Ms. Alma, the founder and president of Louisiana Center for Health Equity.
Good afternoon. Welcome to everyone. I do have a presentation that I would like to go through with you all, and I'm going to go through it kind of quickly. So we started this organization 15 years ago with the notion that we could make a difference in the state of Louisiana. I believe that we have made a difference. However, it still has not moved the needle in terms of Louisiana being a healthier state. We are still 50th. 5 years ago, at the midpoint of this health summit, the planning team members decided that we needed a vision to galvanize people in the state of Louisiana, to inspire and encourage people to work together, to coalesce and to collaborate for the greater good, which is improving the health outcomes and quality of life for the children and families in Louisiana over this decade. That is what LA40BY30 is. When we started this in 2020, using baseline data of 2019 from America's Health Rankings, we identified what you see on the screen as the key health indicators for Louisiana if we are to improve the health outcomes in our state. And the four that you see with the asterisks are highlighted: children in poverty, maternal mortality, infant mortality, and adverse childhood experiences are the priorities that we have been focusing on for these last few years. Four key pillars of this initiative, which is to establish an Office on Women's Health, or a systematic approach to improving women's health, and that was through getting an office, which we did. Prioritizing and adopting America's Health Rankings, the key health measures, which I just showed you, which we did. Implementing trauma-informed approaches and services for adverse childhood experiences. And the last one, we have not taken that on as a primary initiative for LCHE, but in these last few years, as we have observed what's happening on the state level around having a livable wage in this state to address the deep poverty that we have, we realized that we have to take a different approach. And so now we are rethinking and retooling that strategy, and we will be launching an initiative around how do we invest in communities, more of a community investment strategy. I just want to mention the State Health Improvement Plan, State Health Improvement Assessment, because our partners, the Louisiana Department of Health, this is how this summit came together. This is how we began collaborating, was around this State Health Improvement Plan and assessment. The state goes through a pretty extensive process to find out and learn from communities across the state and to develop the State Health Improvement Plan. But I do want to point out that their process is a community-owned process where community is very much involved. The State Health Improvement Plan has identified 4 priorities: behavioral health, chronic disease, community safety, and maternal and child health. And I will say that there is considerable alignment with LA40BY30 and the State Health Improvement Plan. I put a few examples up here for you of some of the KPIs from LA40BY30 and from the State Health Improvement Plan. These are just a few. There are many others. So let's talk a little bit about the progress that we have made toward LA40BY30. Medicaid expansion. Louisiana Center for Health Equity, we led the effort, organizing the campaign, the coalition, to get Medicaid expansion enacted in the state of Louisiana. Many have benefited over these years from Medicaid expansion. I will say here, though, that it is under threat. With the One Big Beautiful Bill, we are going to see some rollbacks in our progress there, unless something changes between now and then. Additionally, the Office on Women's Health, I mentioned that was one of our key pillars of LA40 by 2030. We also have organized a campaign, a coalition, and we got legislation passed to create a state office on women's health and community health. And that office is up and running within the Louisiana Department of Health. Around the behavioral health, mental health, and particularly trauma-informed services and supports for children, mostly we've been focusing on. We got legislation passed, HR 173, where we led a study on student behavior, discipline, and mental health. So much progress has been made in terms of legislation related to behavioral health and mental health. This is just a photo of the bill signing, one of the key pieces of legislation that was passed last year that Governor Landry signed into law, and he held a bill signing ceremony on, and he spoke personally about the importance of it and the crisis that we have, and his support for mental health and mental health services in Louisiana. So we have made some progress, right? We are making progress, but we're still 50th. Let's talk about why we are 50th. So we know that we have significant health disparities and inequities in Louisiana, and they are pervasive and they continue. High infant and maternal mortality, chronic disease burden, limited rural access, and behavioral health, and you can read the specifics under there. So as we were preparing for this presentation, we looked again at America's health rankings 5 years later. Remember I said that our data for LA40 by 2030 was based on 2019 data. The indicators, the outcomes, the health measures that's keeping Louisiana at the bottom are listed up here. What does that say about our state and the conditions and the quality of life for the people of Louisiana? Now, in order for us to really turn the tides, it's really going to take all of us, all stakeholders group, community members. There's something that everybody can do to help us move this needle. Economic hardship. When we talk about economic hardship, why do you think so many people struggle in Louisiana? Why do you think we have such deep poverty in Louisiana? It has to do with the policies. Minimum wage is still $7.25. The cost of living is double or triple that. And so people cannot afford to be healthy. And so until we address that number one issue of economic hardship, it's going to be very difficult and almost impossible for Louisiana to move from the bottom and become a healthier state. Look at this map. You can see here the areas that are most impoverished. The darker the area, those are the most impoverished areas. And actually, this has gotten better. We've improved here slightly since 2019, since we started this process. So we've gone up about 2 points. But we still have deep poverty in this state in areas that experience significant poverty. So what have been some of the setbacks for Louisiana? There is income inequality. The legacy of Hurricane Katrina, COVID-19, many people died. And we just had a town hall this morning on the one big bad bill, I think that's what my colleagues call it, the One Big Bad Bill Act and the threats of that. But we know that, again, much of the progress that we have made, especially with access to health care, will be rolled back. Food insecurity is another one of the indicators where, of course, we both align. It is an indicator for LA40 by Health Equity and for the SHIP. The state's plan, they identified the target as 13.1. The base was 14.8, and we are now at 18.1. So what does that say? We're going in the wrong direction. So, kind of where do we go from here? We want you to be a part of crafting and designing and developing our strategy for how we move this state forward. But looking at where we are now, it is important that we continue to prioritize women and children because they're faring poorly in this state. Adverse childhood experiences, if we're going to move Louisiana off the bottom from 50th, we're going to have to continue to address adverse childhood experiences. We have to start early. We have to have supports and services and resources in place to ensure that our children are healthy and thriving and survive. If we are going to be a healthier state, our policies, we're going to have to shift. Our people have to become a priority. Last year, around this time, we actually embarked upon tours across the state of Louisiana. We chose to focus on rural communities. We wanted to go into some of the smaller communities that have fewer resources. We wanted to hear directly from the people in those communities what their concerns and needs are. We have already so far made 5 stops across the state. Here you can see what some of the key points are that we have learned so far. Access hinges on distance, delivery mode, and cost. Support must be visible and embedded in trusted community hubs. Equity is structural, it's not incidental. Primary care should be in schools. I think that more school-based primary health services should be available, especially in these rural communities. People need to be more informed, more educated about health and health resources, where the resources are, how to access resources. This is just a little graphic from one of the locations. The first stop we made was to Natchitoches, people saying that transportation is a major issue. The top 3 responses by theme from the tour so far have been accessibility, health education, again, that health literacy piece, and community engagement. We learned from this tour, many of the people in the community are not involved in any significant way in health and healthcare in terms of how healthcare is delivered across this state. And then levers for change in terms of immediately is bringing services closer, providing navigator education. So how can you get involved? I put up here a slide that has the QR codes, and to join this movement, connect, get involved, share your thoughts. We want to hear from you. We want to hear your stories, because when we're talking to policymakers, they don't care about the data, but they do care about people. I hope that this presentation helped you in some small way to understand a little bit more about why we are here, what it is that we are working diligently to accomplish in the state of Louisiana. Without a vision, my people perish, the people perish. And I will say, if we don't have a vision, we certainly will never get there. But if we have a vision and enough people are able to embrace and catch the vision, we just might do it. So next I have the privilege and honor of bringing up Mr. Austin Badon, who is the district director in the office of Governor Jeff Landry. Austin is a seasoned public servant and respected community leader, currently serving as the district director, and he previously held the role of Orleans' first city clerk court from 2019 to 2022. And when I first knew him, he was in the Louisiana House of Representatives from 2004 to 2016. I'm going to go ahead and bring up right now Mr. Austin Badon.
Good afternoon, everybody. I'm not going to be long because I don't want to stand between me and the legend over here, retired General Russel Honore. But I did want to thank Dr. Guillory for having us here at the beautiful Dillard campus. It's always good to be back here amongst the oaks over here at Dillard, and to also see my alma mater, St. Augustine High School. I wasn't in the band. I didn't play a musical instrument. I always told the girls I was in the band because it was cool to be in the band. But I am happy to be here to represent our Governor, Jeff Landry. He asked me to read a statement on his behalf. He is definitely in full support. Of course, he regrets not being here, but he sends his full support for LA40BY30 initiative. He wishes to commend Ms. Alma Stewart Allen and the Louisiana Center for Health Equity for their leadership in bringing together stakeholders to address health challenges across the great state of Louisiana. On behalf of Governor Landry, thank you for your commitment to improving health outcomes in Louisiana. The administration is working to expand access to mental health services, including Medicaid coverage for partial hospitalization, and to ensure families receive timely and community-based health care. With over 1.6 million Louisianians relying on Medicaid, the governor remains committed to protecting rural hospitals and advocating for sustainable reforms that preserve access to care. Improving Louisiana health care ranking is a shared responsibility. The governor encourages continued collaboration across sectors to implement practical, community-driven solutions. Reaching the top 40 in health outcomes by 2030, especially for women and children, is a goal for the governor, and he supports your work here today and asks you to move closer to that vision. The governor thanks you for your work and wishes each of you all the best and well in your endeavors. Thank you for having me.
It is my honor to bring back to this podium, 10 years later, help me welcome Lieutenant General Russel Honore to the stage.
I want to reflect on two things. One, the impact of poverty on your health care, and to a point where it's a determinant on our outcome. All things being said and all things being equal, we live about 10 years less lifespan in the polluted Cancer Alley than the rest of the nation. And the multiples on things like asthma is, as a famous guy said, it's 1,000 times worse when you look at the outcome when it comes to asthma on the impact of all the population. And it's not the predetermined piece on it is poverty. Not just skin color, but poverty is a determinant to your life expectancy. And for a long time, social activists have described that your area code should not determine your success. But I grew up in poverty, and I know the impact. By the time I went in the Army, and they did a dental exam on me, my teeth were already destroyed from periodontal disease that had not been detected. So poverty has a compounding impact on determination. Now, I made 78 this week. And I'm retired, but I'm not tired. And what that brings to mind is that along the way, through a proper diagnosis and treatment, I get an exam about every 6 months. So I'm blessed because one of the secrets to determination is early diagnosis. And if you don't have regular checkup, if you don't have regular blood tests, it leads to that predeterminant. Now I want to commend Nurse Alma for leading a non-government organization that advocate for good health. Because regardless if you're poor or not, good health start with that person you look at in the mirror in the morning. A part of the predeterminant is our culture and our habits. Well, one of the things when I grew up in Louisiana, a lot of the things we talk about exposure to in the food chain, we didn't have to worry about it because we couldn't buy it. So we were not distracted by that. We would make boudin twice a year when we killed a hog. Now you got boudin on every corner in Louisiana, in every country road. And while it tastes good, some of the things it might do to you could be a part of your self-determination. But poverty is the leading one, and an insensitive government that don't pay as much attention as it should to testing the air and the water we consume. Looking at some data in North Louisiana, Nurse Alma showed you a chart of those parishes in North Louisiana we commonly refer to as the Black Belt. You got people up there that's still using outdoor toilets. You got parts of Lafayette, Louisiana that don't have sewage. The water runs out and leaches in the front yard. And we have areas on the North Shore in St. Tammany and Tadbahoe Parish where when it floods, sewage pop up on the street. All of those are setting us up for extensive health issues in the state of Louisiana. We are not last by accident. We've gone before the legislature, and I've heard the argument about putting in mandatory air monitoring next to the big plants. The last quote I have for you is one senator told me, Well, if air monitoring is going to cost the plant money, I ain't for it. Now, he was elected by the people, right? But he's representing the plant. This is the total disregard our legislative body has for the health of the people. We're not last by accident. And I want to emphasize two pieces: the impact of pollution. Number two, the underinvestment in mental health. I think some of our mental health, if Kennedy and Trump can talk about it, I can talk about it, is attributed to lead exposure. It's studies that directly show lead exposure, which we did not expunge in America. There's a common denominator when you go in these inner cities and you do test for lead, you'll find lead exposure. That is a predeterminant on how young people behave. We got lead exposure in New Orleans. We had lead exposure in St. Joe. But America has never completely eliminated the lead exposure. But I want you to remember this, because you need to run for office and you need to change this. Because you're not going to change it until you change the politics. And this is why we need NGOs, because guess what? The government is not good enough to do this. The government is not good at influencing you to make the right choices in the course of a day. I remember going to a meeting. I'd given a speech at this big Fortune 500 company. I finished my presentation and I stayed around waiting on my airplane, and I stayed for their lunch. They invited me for lunch. And after lunch, one of the CE suite leaders got up and they showed this chart. And on that chart, they said, we expect continuous growth over the next 30 years. The continuous growth is based on the projection of adolescents with diabetes. Now, what caused diabetes? Lifestyle, habit. They weren't worried about where the economy was going because they saw a steady gain in their products to treat diabetes, because they're projected is going to continue to grow and it's going to affect people at a younger age. And we know the outcome from that. We know the outcome from that. The good news I saw yesterday when we talk about the impoverished and the impact of some of the things Nurse Alma talked about was yesterday Mississippi declared an emergency. You know what it was about? Prenatal deaths. They can no longer hide it. We've gone long enough in Louisiana by not discussing it. Compounding disasters on the same population. So I got to put our pain here in Louisiana in perspective, because a lot of the challenges we have to do with that person we look at in the morning. Because you see, you can be poor and still eat healthy, right? The things that get us when we are poor is late diagnosis. And then when we are diagnosed, as I've been told by experts, the scheduling to get that care that you need, to get operated on, to have a procedure, could be weeks, a month, and with a cancer, that's a problem. The other issue we face with in determination in Louisiana is we have something called the Louisiana Tumor Registry. One of the finest, biggest building in New Orleans is right next to Interstate 10. It's called the Cancer Research Center. We built that with big money. They were supposed to be to study cancer. They hadn't done jack. And then the tumor registry, we've got issues with the tumor registry, formed by the legislature, paid for in part by industry to get started, and the accuracy of the data. Can you imagine when we have so much cancer in Louisiana, we needed a tumor registry. But we've got to get a better way for them to collect data. And the other thing we've got to get is how we get the tumor registry to share that data. They're reported to the Department of Health, who's understaffed, and they don't have time to read all this stuff. We've been through this. We've had meetings with the tumor registry and with the Department of Health in trying to create some legislation. But they're collecting information, but how we have access to that information is restricted because certain of Louisiana laws. It's not the people of the Department of Health. There are laws that regulate how they operate. And one of them rules and laws is, well, you can't say based on the tumor registry, that there's a problem with cancer in St. John Parish. And you don't have access to that information unless you're a researcher and you can show you have cause to get that information. Because what we don't want to do in the state is violate HIPAA, in that the people in that community will get scared if they know there's a high rate of cancer. This is conversation we've had with lawyers and legislative representatives that we need to release this information so people know. The truth came out in COVID. Where do you think one of the highest death rates happened in Louisiana? Because of the upper respiratory issues there associated with pollution has some of the highest death rates in America. What we need is the people in this room is to be active in your government, pray hard, but move your damn feet. You with me? Be self-aware, help people, challenge the status quo, because poverty is a self-determinant. In where we live and our zip code and area code can determine our life expectancy, and generally speaking, that's about 10 years less than the rest of the state. But we can do better. We can prepare. We can prepare by looking at what we eat, what we drink. That's a part of it. We can look at our family history. All this is possible to come to solutions with leadership. Leadership is the ability to influence others to accomplish tasks. Leadership is the ability to create change. The 3 points in closing on leadership I want to tell you is do the routine things well. Be your own good steward of your health and that of your children. Number 2, this look impossible, but I can tell you making health better for Louisiana will not only keep more people alive, it will increase our economy. So take on the impossible, because the future is dependent on us doing the impossible. And point 3, embrace change, because we need change. Because where we're going, the numbers ain't looking right. So we got to change something. One of the biggest industries in Louisiana is the healthcare industry. It's the only growing industry in the state. It's the healthcare industry. Much of that happened is because the result of Obamacare. Because more people got what? Access to health care. How do we get that on a timely basis and how we keep it? But let me tell you, there's a lot of crowd at the starting line. But put this in your leadership book. There's no crowd in the extra mile. And I think our nurse runs in that extra mile. Would you believe in me? Yeah. She runs in that extra mile. God bless you. God bless America.
Good morning, everyone, and welcome to day 2 of the Health Summit. Again, my name is Cain with the Louisiana Department of Health, Office of Public Health. I have the pleasure of, again, welcoming you to day 2, and we're going to kick it off with our morning keynote speaker, Dr. Brian Castrucci. Dr. Brian Castrucci is the president and chief executive officer of the Beaumont Foundation. He has built the foundation into a leading voice in health, philanthropy, and public health practice. An award-winning epidemiologist with 10 years of experience working in health departments of Philadelphia, Texas, and Georgia, Brian brings a unique perspective to the philanthropic sector that allows him to shape and implement visionary and practical initiatives and partnerships and bring together research and practice to improve public health. I would like to welcome to the stage, and thank you so much for coming, Dr. Castrucci.
How y'all doing? Good. Okay, organizers, if I take this off and walk around, do you care? Okay. I can't do public health from a podium. Did y'all see that video that was playing? That was interesting. That was really interesting. I thought it was really important. Being black, there is little room for error. And so what struck me about that video was I'm the same as them. I have a history of diabetes in my family. I have a history of obesity, right? I have high blood pressure. I have all those things. The outcome is different for me. So let's face it. If I was poor or I was of a different race, I'm probably dead. That video kind of said the quiet thing out loud. You see that guy from Camden? I grew up, I met my wife when I lived in New Jersey, and I know Camden. Camden, New Jersey is 5 miles away from where my wife's family lives. And if you start driving in Camden, you are in one of the poorest places in New Jersey. You drive 5 miles, you see no grocery stores, right? Everything he was talking about, no grocery stores, check cashing. The disparities that we see are created by systems and policies. The trick isn't that the disparities exist. The trick is we blame individuals for them. Right? That young lady who said, I don't want to do drugs, I want to do alcohol, but I can eat a brownie. Well, she shouldn't have eaten that brownie, right? You make those choices to be obese, and then you have to suffer the consequences. She didn't make that choice. You only have the choices that are presented to you. We have done an amazing job in this country of getting people to believe that their health is their problem, is their fault. Their health is not their fault. Their health is about the policies that we make and the systems that we build. If there are no places to eat that are healthy and there are no places to exercise, how do you do those things? And that's what we're taking away from people in our country, right? While we blame them for their situation and we blame them, there's a very common thing. We want to put the onus on you to take it away from us. Our choices made you unhealthy. The fact that we've allowed corporations to profit off of people's obesity and diets, right? We can fix that. That's how we have to move forward. So I do a lot of talks, and I talk to public health people, and it's really easy. I do them a lot. This talk, it's sad for a minute, right? Because this is hard, because, y'all do the work. So it's not easy to con you all with some fancy PowerPoint slides and some pyrotechnics. So I was like, what can I do? What can I leave them with? Something that they can put in their pocket and keep with them in how they think about their work going forward. Because y'all aren't taking the easy work, right? Louisiana is not like, well, we're 12th in the nation. We want to go to 11th. Y'all are at the back and you want to move up, right? That's the thing. How do we bring Louisiana from last to leading? And as we do it, how to create a more healthy and equitable Louisiana. That is the goal, right? If you are not into hard work, leave now, right? I mean, this is straight, right? Like, you want easy life, just get up and go. I'm sorry to throw people out of your conference, but just don't stay. This is hard work, and you're choosing to take it on. And I could get up here, and of course, I'm an epidemiologist by background. And so I looked at the data. I'm like, I'm gonna look at the data. What does the data say? The data says things are not good here in Louisiana. There are major disparities. And you know these data so much better than I do. Differences in maternal mortality, differences in life expectancy gaps, uninsured rates, food insecurity. When you really look at the data, there's not even one that we can go, oh, this is really good and we have to improve these. It's hard. And it's overwhelming because it's cross-sectoral. You're not leading in education but bad in health. You're not leading in the economy but bad in health. We have challenges. I don't believe that Louisiana lacks resilience or community. I believe that we lack the policies and the investments that honor the strengths that we do have. And if we want to rise in the health rankings, we have to stop treating illness and start building systems that prevent it for everyone. Where you go from here. Because if I could give you the answer to how to fix Louisiana, I would just sell that and not be doing talks. I'd say, this is how you fix it. Okay? What we have to do is start changing our perspective. Now, we could go to different groups, like, we're going to help you with your diabetes. We're going to get you a continuous glucose monitor. Those are useful. Those help people know what's going on. But those are symptoms. Unfortunately, America makes us sick. And Louisiana leads the nation in making its people sick. So there aren't enough continuous glucose monitors. There's not enough medication. Those are all solving the symptom, not the disease. The disease is our lack of policies. The disease are the choices that our elected officials make. So maybe it is a diabetes education course, and you should do that in your communities. But you know what? Next time this election comes around, you're holding community forums and you're saying to those elected officials, come talk to us about how we make our community more healthy. And you have a buzzer there. And when they start talking about health care, buzz them. I didn't ask you about health care. I asked you about health. They are different. Find me an elected leader who knows the difference, and I will give them an award. I don't care whether you're a Republican or a Democrat, you don't get public health. You might get health care, you might get social service, but you're not really making the policy decisions that we need to make us healthier, because the community is making us sick. The decisions that we're making are making us sick. And that's what we continue to not want to confront. Of course, you can go into your communities and you can work with people and you can make them individually healthier. But understand that the work that you do, you are like salmon going upstream. The forces of policy, of economics, they're working against you. The question is, how do we reorient the flow of the stream? How do we hold people accountable? How do we help elected officials understand where you place a bus depot directly impacts people's health? It's the policies. We have to make the case that health disparities don't start in a hospital. They start with zoning laws. They start with Medicaid policies, with tax codes. We make a decision in this country that certain people are going to prosper and certain people aren't. And then we make it some like sort of natural thing, like, well, it's biblical. Jesus said there'll always be poor. I don't think he meant it to endorse your policy position. There are ways that we can all work together to make this nation what we want it to be and not perpetuate the disparities that we know are there, that we created. The only thing that can fix policy is policy. Policy fixes what policy broke. We need to start thinking about policy as medicine. Do we have voters here? Yes. Yeah. This is what we need to be telling them. This is where, listen, you probably aren't going to run for mayor, and you probably aren't going to run for governor, but you can be on a planning commission. You can be on a local board of health. You can bring your public health and equity framework to those places where they don't have it. This is important. To interject these perspectives because people don't have them. I don't think that people are actively always working against them. I just don't think they think about it, right? One of our challenges as a society is we're a very individualistic society, right? We think about me first. In this room, what's fun about public health, why I love doing this work, is we are a group of people who think about we first, not me first. The one thing that I'm going to ask you that I think is going to be hard is I need you also to be thoughtful about how you talk about health equity. What I'm going to ask you all to do is when you think about the work you're doing ahead, is who are the partners you have? I saw something earlier that said cross-sector partnership. You all work with a lot of partners, right? Yeah, you have partners. Do any of them skeeve you out? Like you look at them and go, I don't want to work with this guy. This guy kind of makes me gross. If you're not working with someone who makes you gross, you're not working hard enough. That's my challenge to you. Don't let people educate themselves. There are too many people who are absolutely willing to step in and educate them. People with very, very bad intentions. People who are willing to spread false ideas and false logic. And it makes our job harder. This, gang, is our responsibility not to talk about health equity in a way that resonates with us, but a way that resonates with everybody. So I am just asking you all to take a moment in the next year, think about your language. I think every kid should have every chance to succeed. So I looked at this nursery of all these kids born minutes ago, but already there were disparities in that nursery. Already some of those kids were behind some of those other kids. And I know that's not right, and I think I would be hard-pressed to find people who would say that's right. They're there, don't get me wrong. How do we start conversations? This is the one thing I want you to also keep with you. What I know is I don't care how different you are, no one wants to bury their kids. Nobody. And some people, that is much less of a concern for other people. And that's just not right. You can start a conversation there. But look, go to that toolkit. Go to the Frameworks Institute. Frameworks has messaging guides on how to message health equity. I message it again. This is the most American thing there is. And I'm going to keep saying that. Everywhere I go, I'm going to keep saying that. And sooner or later, it's going to catch on. And sooner or later, our numbers will grow because we will have better messaging. We will bring more people together. And that we'll get more people voting. Because if we haven't learned that voting matters, we are living that lesson every minute of every day right now. So we have to think about, again, the policy solutions, not the you need to take your medicine, you need to stop eating sugar, you need to exercise more. What's going to let you eat better? What's going to let you exercise more? How do we build our community so that we can walk in it? Because all this stuff that we're talking about, racism, sexism, our neighborhoods, our communities, our employers, all of them are dictated ultimately by the political determinants of health. These are all Medicaid. We got Medicaid because of Congress. We will lose Medicaid because of Congress. We got SNAP because of Congress. We'll lose SNAP because of Congress. These are political decisions. These are political decisions. We must tackle our systems issues with policy. So that's when I think of what you guys are trying to do, this move in Louisiana to 40 by 2030. It's doing a landscape analysis of what policies are missing in your local communities. Now, when I talk about policy, I do not mean what's happening up in DC. I will thank you all for having me here because everybody said hello to me this morning. It was lovely. I walked in, good morning, good morning. I was nervous because in DC, no one even looks at you. You could fall in the metro and be laying on the tracks and they'll be like, oh, well. Right? What are the policies? And I don't mean Trump. I don't mean your governor. I mean local policies. It doesn't, so everybody in this room is a voter. You don't know enough voters to swing a federal election. You know enough voters to swing a city council election. You know enough voters to swing a school board election. And that's where we can start making change. Imagine people who had our framework of health equity and policy on a school board. City councils, mayors, they have jobs. You stop your mayor in the grocery store to complain about the pothole in your street. Most mayors don't have security details. Most mayors aren't Mike Bloomberg. They're good citizens who are just trying to help their community. And they want to be there with you so you can do that work. That's the work ahead. You will get Louisiana to 40 by 2030. 2030, we're going to do that one community at a time. There's not going to be a pill that will do it for the whole state at once. It's going to be us saying, look, if we got this policy passed in these 4 cities, and if we got this policy passed in these 7 parishes, we will actually start to see this progress made. But you got to change it in the environment with the policy change. If you show up to a hotel with your swimsuit, you get your swimsuit on, what does that hotel have to have? A pool. So wait, you're telling me just because I wear a bathing suit, I might not be able to go swimming? Unless that hotel has a pool. Our communities are the same. We want health, but we have an environment that is constructed not to give us health. And that's the thing that we have to think about. And we want to continue. Hear a lot of the stuff that folks were talking about yesterday. Tell those community stories, but tell the community stories in the right way. Tell the community stories that bring people together. We're going to do this. We're going to do it together. You're going to need a coalition of all different types. Okay? I'm really good in certain settings, and you're really good in certain settings. And so we need people to infect the settings that they're in. As someone who is a Republican, when I'm in Republican spaces, I talk about public health a lot, right? I've worked with Republicans. I went over and did a whole bunch of work during COVID to get conservatives vaccinated. And I didn't agree with everything that people were talking about politically, but I found people who cared about getting people vaccinated. You are trying to do the hardest damn thing You're trying to undo 250 years of American choices. That's what you're trying to do. Everything was a choice. You are trying to undo 250 years of bad decisions. That's really hard. But the passion that you guys have, the strength of this room, that's what I really care about. I care about you guys being able to do this work and do it well. I don't want you to be frustrated. I don't want to continue to take losses. Do you ever feel that way sometimes in public health? Like, I'm sick of losing. I'm going to go do something else. I would like to win. What I want you to really think about, and I want you to do this, I want you to be very deliberate with it. Don't blame the administration for any of our losses. The only people we can blame for our losses, the only people who can fix our losses are us. And we can do it by focusing on policy, by communicating more effectively, and building the coalition that will get us to where we want to go. I don't want a healthier Louisiana because it's good for the people. I might not care about that. What if I don't care about the people? That's a bad message. I want it so that your parishioners can come to worship on Sunday. I want it so that school kids can get better grades and graduate. I want it so that our businesses can thrive and we can have a strong economy in this state. Talk to the people from their point of view. What's in it for them? I admire you all. I think what you all are trying to do in Louisiana is amazing. It'd be a lot easier to move. Move to Michigan. Move to another state. Move to Massachusetts. Massachusetts always has the best health. And then you could declare victory. You guys are doing the work that this country needs. You are working uphill. You are working against the current. The only way we're going to get to 40 by 30 is if we change that current and we find people who will help us change the current of the river. We're only going to do that if we find people who, when we're tired, put a hand out and help us up that hill. Hopefully you leave here, again, not with some like, oh, that was the thing that solved it all. I don't have the solutions. I wish I did. But hopefully you leave here today with something that you hold on to. Keeps you going. Changes your perspective a little bit. Someone's going to say something to you, and it's going to be something you don't agree with, and you're going to be ready to be like, what? And you're going to stop for 1 second. And you're going to say, what was that crazy thing he said? And then you're going to take a second and go, tell me more about that. Why do you think that? Help me understand your point of view. And we're going to have a dialogue. I understand I'm asking you all to accept a greater burden, even though you were the folks who were most impacted by the bad decisions that this country's made. I get what I'm doing. But there's no other choice. People aren't giving up just because they're like, oh, we should have it. I'm against equity, but gee, I think it's a good idea now. We got to convince them. We got to get to the hearts of our policymakers. We got to talk to them. That's the challenge. That's the path that we have to be on. And I hope in 2030 we are here and we're celebrating that we've met that goal. But it is in your hands. You are amazingly powerful. Focus that power into policy. Focus that power into politics. Again, next time there's an election in your parish, in your city, in your state, again, I want somebody in here to say, we're going to have a town hall meeting about our health and our economy, and we're going to invite all the candidates, and we're going to see who shows.
I just want to say that our time together has been well spent. There has been so much information. Even I feel a little on information overload. I'm going to have to take some time to digest and process a lot of the things that I heard over these last two days. The town hall in and of itself was just so full of information about what is in the what is in that act that is now a huge threat to Louisiana. But I want to just start by saying, you know, in my opening on yesterday, I said, we are here not just to talk about change, but to build it. This entire summit is about change. The change has to start with us. Each and every one of us has a responsibility, a duty, a civic duty and responsibility, an obligation to be a part of shaping this great nation and the democracy that we all hold dear. So it is imperative that we show up, that we speak up, and that we exercise our right. We use our voice. Our vote is our voice. So I want to kind of close with this. This summit was such a huge, I'm going to say for me, it was a celebration in many ways. We were celebrating some things while we were also lifting up and reflecting on, but also looking to the future on other things. So I want to kind of give this little timeline. So this year, in August, marked 20 years of Hurricane Katrina in the state of Louisiana. This year marked our 15th year anniversary of being in this arena, the health equity space. And when we first started this organization, few people knew what health equity was. Most people had never heard of it, didn't know what health equity was. It wasn't widely embraced. It was not popular. For 10 years, this year marked the 10th year anniversary of Medicaid expansion in the state of Louisiana. I'm still going down this timeline. 5 years, and I'm almost finished. 5 years of LA40BY30. And LA40BY30 came out of this work, out of this summit 5 years ago. And while we have made some progress, we have some things to celebrate and to be proud of. Just like we talked about Medicaid expansion, which actually came before LA40BY30, but we've made some progress. Office on Women's Health, significant reforms around behavioral health. We are making progress. And we have 5 years left to still reach the goal. Because yes, as I pointed out in my presentation, my opening presentation yesterday, we've had some setbacks. And the biggest threat yet is the OBBBA. Because not only is it going to shape the future in terms of people's health and the quality of life for many in this state, it is also going to undo much of the progress that we have made over these past 10 years. But what will you do? What will you take away from today? How will you use your sphere of influence? Because everyone in here has a sphere of influence, even if it's just with your own family. I will say in closing that I want to thank everybody that's been a part of this conference over these 2 days. I want to lift up once again our partners and thank Dillard University and to thank the Center for Racial Justice here at Dillard University for hosting us. Also our additional sponsors, Tulane University, AstraZeneca, LPHI, Our Lady of the Lake, and the Beaumont Foundation. We could not do this without you all. I want to thank our additional partners who came here to be with us, Families USA. They're not listed on the program, but thank you, Families USA. They have been a great supporter and partner throughout this summit and with the town hall, bringing in national experts to speak and to give us the facts. Also, National Health Law Program with Rachel. Stacy's from Families USA, as you know, Rachel, and we've had more than one person here from each of those organizations. So thank you to National Health Law Program, also to the Balm of Gilead, who again another partner that is not listed in this program other than as a speaker. But these organizations, national organizations, also played a key role in our conference and the town hall over the last 2 days. So thank you to everyone that was able to be a part of this conference and that is continuing to do the work even during these tough times. And I will leave you with this. When I opened, I said to you when I was introducing myself, this is also in terms of that timeline, I should have started with this, 50 years. My medal to show it. I graduated from Northwestern State University BSN program in 1975. And this year, I was honored to have a 50-year, well, Golden Jubilee is what they called it, graduation, medals, cap and gown, another diploma, the whole 9 yards. So 50 years, 50 years that I have personally been on this journey, this healthcare and health journey in the state of Louisiana. I love this state. My family is here. It is my home. And I hope to leave it better than I found it. That's my goal. And that is why LA40BY30 is a passion and why I work towards making it a reality. And I do believe, as someone said a few minutes ago, 5 years is still a long time. We can accomplish it. And if we, and I say we can accomplish it, when I say we, it is a collective we. It is going to take all of us, and it is going to take, as Brian said, some policy changes. Because the reason, as I opened yesterday, that we are where we are is because of policy. And we see the continued policy changes that are moving us in the wrong direction. The OBBB will take us further away from our goal, further away from being a healthier nation, a healthier state, and having healthier communities. So we have work to do, collectively and individually. And I invite you to continue to be a part of this and to continue to engage. I invite you to reach out to us at any time, in any way, and to let us know if we can support and how we can help. And so with that, I will close. Thank you. We are at our time. We have had our time well spent. Have a good and safe trip home to everyone. Thank you.